is day 12 and I would like to discuss a bunch of points that I have gathered over the past few days, and I think it's very important that all of us know. The first and foremost important point is keeping the leg elevated. Basically, keeping the leg in horizontal position gives you the least pain. Every single time in the last 11 days that I have tried to stand for longer than I'm supposed to, even with the walker or crutches, within 2 minutes I start feeling pain. If I push myself to 5 minutes, I have severe pain throughout the day and I have to take painkiller. So you have to make sure that the leg is elevated at all times and use as much ice as possible. In the first 8 to 10 days, I would say, you're gonna need it every time you go to the washroom and come back, so that the swelling or the redness that's around the knee and ankle can reduce a little bit. Second point, your ankle. It'll keep rotating to the lateral side, and we have to make sure that your ankle at all times is straight as compared to the position of your knee. So what you need to do is just use a small piece of towel and put it under the knee position. When you push it under the knee, as I can show in the picture next, you'll realize that the ankle is straight. So it's a lot more easier and it hurts your knee less. Third point, please do not pull on your legs on your own when you're trying to move out of the bed or changing positions or shifting the position in your chair. If you try to pull on your leg, it's like there are two twigs which are attached with a small piece of thread, and you're pulling on the thread, which is your ACL. So you don't want to cause any trauma or harm unless your doctor says it's okay to pull on your leg. I'm guessing it'll be after 2 weeks to 3 weeks at least, but it depends. If you had meniscus surgery, then at least for 4 to 6 weeks, depending on what your doctor says again. Do not try to put pressure in the wrong position. Point 4, pillow. It's very, very important that when you are sleeping or when you are not sitting in a supine position, you should have the pillows in T-shaped position so that your leg is elevated a little bit higher than the level of your chest. That will prevent your leg from swelling up or your ankle from swelling up. Point 5, very important to remember, which I did not know, that because of sitting on the bed all day, I started having severe backaches. I have never had back problems, touch wood, and suddenly I started having issues. I started using this hot water bag. It's very, very handy. You can get it for $5 to $15 anywhere, Amazon, eBay, doesn't matter. And you just put hot boiling water in it. The effect will last at least 7 to 8 hours and it works amazing. I started doing some stretching exercises that helped me a lot with the backache as well, but just something to remember. Next point, eat healthy, be happy, be positive, a lot of hydration. Since you're not moving around, you won't feel that you are too hungry or thirsty, but it's important that you take care of your health, because if you don't, nobody will. And the last point, it's very important to remember that please, please, please know that this happened for you and not to you. That means the universe did this to all of us for a reason. We need to learn something from it. I don't know what your reasoning is, but what I have learned is slow down. I overwork myself, and this has helped me realize that I have to slow down and pause and look at things around me and appreciate it. I also have learned to accept and ask for help. I have been very independent, and this really helped me calm down a little bit and listen to a lot of lectures, podcasts, TV shows, everything that has been pending, calling those long lost friends whom you met in school and college. Do it all right now, because this too shall pass and you'll be able to walk and run again. Thank you so much for listening. Ciao.